Hello and welcome to Pace Hospital's podcast. Today, we are focusing on an important topic that concerns many patients after surgery, that is, inguinal hernia, post-operative care, and frequently asked questions. Inguinal hernia repair is one of the most common surgical procedures worldwide. While the surgery itself is effective, patients often have questions about what comes next, including its recovery time, activity restrictions, pain management, lifestyle changes, and long term outcomes. Joining us today, Dr. Suresh Kumar, a highly experienced surgical gastroenterologist and laparoscopic surgeon. With his expertise in abdominal wall hernias, Dr. Suresh will answer frequently asked questions about inguinal hernia post-surgery care, helping patients understand what to expect during recovery and how to ensure best results. Stay tuned as we address the most common doubts and provide expert guidance for a smoother and safer healing journey. Dr. Suresh Kumar, thank you for joining us at Pace Hospital's Hitech City.
Hello all, I'm Dr. Suresh Kumar, consultant surgical gastroenterologist and laparoscopic surgeon at Pace Hospital, Hitech City. Today we shall talk about inguinal hernia or groin hernia. So of late, inguinal hernia is one of the most common surgical problem we face day in, day out. So I have found certain set of questions or certain set of queries which are there in patients who underwent surgery or who might undergo surgery for inguinal hernia.
Let's start by understanding what to wear after inguinal hernia surgery.
So this is one of the most commonly asked questions by my patients. So if the hernia was large enough and it was a complete hernia, I had to dissect too much in the scrotum. The chance of having seroma as a complication is higher when compared to smaller hernias. In that case, I might advise for scrotal support in those set of patients for at least 2 to 3 weeks post surgery. Seroma is nothing but a collection of fluid within that potential space in the scrotum. So by providing external compression with the help of scrotal support, I might decrease the recurrence or prevalence of these complications after surgery.
Dr. Suresh Kumar, how long does swelling last after inguinal surgery?
The obvious swelling which was seen before surgery immediately disappears after surgery, but some amount of tissue edema might be there post surgery. This should not be confused with inguinal hernia swelling. So whenever you see this swelling persistent even after 1 to 2 weeks after surgery, which is gradually increasing in size, you need to consult your surgeon once again. So most of the times it turns out to be seroma and not recurrence of the hernia. Seroma is nothing but a collection of fluid, as I told you, within that potential space.
So doctor, is it really possible to treat or reduce an inguinal hernia without surgery?
As such, there is no medical line of management of inguinal hernia. So inguinal hernia is basically a defect, it's a mechanical defect within the wall of the abdominal wall, especially in the groin. If it is there in the groin region, it is called as inguinal hernia. So this mechanical defect has to be closed with surgery or some kind of process. Most of the times it is the mesh we use to close this defect.
Dr. Suresh Kumar, after inguinal hernia surgery, how soon can a patient get back to their normal daily routine?
So basically, when this inguinal hernia surgery is done through laparoscopy, we discharge the patient on the same day or the next day. So, and we even advise the patient to resume their daily activities like using a loo, sitting and having food, sitting comfortably in a chair and all those things the day of surgery itself, given that he is comfortable enough. So as soon as the patient gets discharged, he is good to do all the routine activities like self activities like watching a TV, sitting in a sofa, traveling for a shorter distance, walking on a flat surfaces as soon as possible, given that he is comfortable doing so.
Can you explain if there are any specific guidelines or timelines for activities like driving and exercising after surgery?
When the surgery is done laparoscopically, he can start driving for shorter distances in a couple of days post surgery, or he can travel for longer distances given that he is comfortable 1 to 2 weeks after surgery. So going to a gym and lifting heavy weights, so we generally advise the patients after 3 weeks of surgery. So whenever he feels some amount of discomfort in the operated area, it is advised to to postpone that activity for at least 1 to 2 weeks. If the patient had to undergo surgery through an open access, this duration might change a little bit. So due to the pain and the wound itself can cause some amount of discomfort to the patient. So it is advised for these kind of patients to start resuming to strenuous activities like driving, lifting heavy weights 3 months post surgery.
So, doctor, is inguinal hernia surgery painful?
So some amount of discomfort might be there in these set of patients, but the pain that is a traditional type of pain usually seen with open hernias is not seen with laparoscopic hernias, but some amount of tugging sensation or something pulling or dragging might be there. It is commonly seen in the patients who undergo surgery for inguinal hernia.
Dr. Suresh Kumar, one final question. Is inguinal hernia surgery dangerous?
Yes, there are situations where the contents which are protruded from the abdominal cavity into the groin through these defects cuts off, have their blood supply cut off or gets obstructed or strangulated, if neglected, can lead to a surgical emergency.
Thank you, Dr. Suresh Kumar, for sharing important insights on inguinal hernia post-surgery care and frequently asked questions with our listeners. We hope this discussion helps patients and caregivers understand the recovery process better. Remember, your health is a priority and proper post-operative care can lead to faster recovery and improved quality of life. If you have any further questions regarding inguinal hernia recovery, please don't hesitate to consult your surgeon or gastroenterologist. With the right care and guidance, life after hernia surgery can be smooth and pain-free. We'll see you soon with another informative episode on Pace Hospital's podcast. Until then, take care of your health, follow your doctor's advice, avoid heavy lifting during recovery, and stay consistent with healthy habits. Stay informed, stay proactive, and stay healthy. Thank you.